Good afternoon, everybody. My name is Chris Nelson. I'm the Communications Director at the University of Utah, and I want to welcome you to our first fall semester town hall. For those of you who joined us over the summer, you know that we talked a lot about the issues that were coming up in fall semester. Now we're here, and we want to provide an update as we get ready to enter our fall circuit breaker and the Vice President debate. Today we're joined by President Ruth Watkins. We'll also hear from Dr. Stephen Lacey, who is the Chief of the Division of Public Health at the University of Utah, as well as Vice President Jason Perry, who is chairing the steering committee. We're also joined on the call today by Senior Vice President Dan Reed, Vice President McDonald, and our Chief Safety Officer Marlon Lynch, as well as Diane Pataki, who is our Associate VP for Research. So we'll go through some brief remarks, then we'll come back with many of the questions that were submitted. So with that, President Watkins, I'll turn it over to you.
Great, thanks so much. And I want to start by thanking you all for everything you're doing to help us function well this fall semester. What you're doing is working, and what you're encouraging is working. We are managing well and monitoring closely as we progress this fall. We want to talk a little bit about what's ahead for the next couple of weeks. At a point earlier this summer when we were planning for the fall semester, we had planned to have a week of online only learning and also a return to remote work during the week of the vice presidential debate. And as we began to work in July, planning for the fall, and as planning evolved across the summer, our infectious disease experts and disease modelers suggested to us that a 14-day return to remote learning and work would be helpful in terms of reducing infectious disease and disease transmission. I think you'll notice from looking at institutions around the country where their infections begin to run away from them a little bit, they are often returning to 14 days of remote learning and work on their campus. I think the beautiful thing about our team is that people had this idea long before there was any difficulty, and we plan to implement it. Dr. Stephen Lacey, our division leader in public health, is going to talk a little bit more about what we have called the circuit breaker and what we hope happens during that time, which is as many people as can work remotely will go back to doing so, will continue to do so, and that our learning returns to remote for those 2-week period as well. So you'll hear a little bit more about that. Of course, there's many other things you're doing and really doing well that are working: wearing face coverings, frequent hand washing, physical distancing, using the out of doors for gatherings, and keeping your gatherings small. That is working. And the other thing that we have been doing that is helping is really responding to public health needs with symptomatic testing, with contact tracing, and now beginning to roll out asymptomatic randomized testing for our campus. I think that is beginning to develop as a tool. We have done a couple of beginning efforts there on asymptomatic randomized testing, and that will continue in the weeks ahead. We'll talk a little bit more about that. That is designed to help us understand the prevalence of disease in the community and will involve faculty, staff, and students, roughly, ultimately, about 600 tests a day. So we are working towards that, and you can read more about that at the U. I'd also mention that our Sugar House testing site was impacted by the wind, and we are working on a campus location that will make that a bit easier for people. So stay tuned, and Dr. Good might talk a little bit about that. I think you also know that we are working on wastewater monitoring, as some others in the state are, and that effort is underway. We are using our talents as a research university to help us navigate this period through many, many methods. You can read about it in more detail at coronavirus.utah.edu. It remains the definitive source of information. Now, I will tell you just a little bit of a headline about the vice presidential debate, and then VP Jason Perry will take over and tell you a little bit more. We're a couple of weeks away from the national spotlight turning on Utah as we host that one vice presidential debate, and we are excited about the opportunity that it presents for the university to be showcased on a very large national stage. We know there are many viewers, and we know it is an enormous viewing opportunity for the university to be showcased. We also know that it's a lot of work for a lot of people, and it is a tremendous inconvenience. I thank you for what you're doing to partner with us to help make that possible. And please know that you are appreciated during this time. The work to host a vice presidential debate started a year and a half ago, maybe even a little bit more than that, and does matter from a civic engagement element. I think it is important for us to engage in the process and the important learning opportunity that takes place for our students and our community does matter to our democracy. So we appreciate everything you're doing to help us make this possible, and we look forward to what's ahead, even as we have prepared very diligently for it. So I want to say thank you to everyone for taking a minute now and introduce our colleague, Dr. Stephen Lacey, who is going to talk in a little bit more detail about the circuit breaker.
Great. Hey, thank you, President Watkins. Good afternoon, everyone. Again, my name is Stephen Lacey. I'm a faculty member in the Division of Public Health at the School of Medicine. And over the past several months, I've worked closely with the President's office and have led the campus incident management team. That's a response framework to organize people and teams that we use to help us navigate COVID. Each week, I engage with at least 100 people that are working to minimize the impact of the virus on our campus. And I think this town hall is a good opportunity for me to begin to thank them for their work. Because I want the campus to know that our emergency managers, facilities, and health and safety professionals are really best in class, in that our campus VPs are some of the hardest working people that I've met, and that our faculty members are serving as subject matter experts and team leaders that are simply getting the job done, and I'm grateful for that. President Watkins asked me to speak to the public health rationale for the upcoming 2-week break. The rationale is rooted in two concepts. The first is the chain of infection, and the second is virus generation time. Now, the chain of infection refers to the disease transmission cycle where there's a host, in this case a human, that is infected with coronavirus. And that virus leaves that infected person, usually through droplets or aerosols, during close contact, and that virus makes its way to infect a new person. The goal is to find ways to break that chain of infection. And one way to break the chain is to simply prevent people from gathering and spreading the virus. The second concept I mentioned is the virus generation time. Generation time is the time duration from the onset of infectiousness in a primary case to the onset of infectiousness in the next case. So for COVID, the generation time is approximately 7 days. So a 2-week break that is planned is 2 full cycles of generation time and of potential transmission. And we can use this to break that chain of infection. Knowing all of this, we worked with Drs. Lindsay Keegan and Russell Vinnick to model a whole suite of scheduling scenarios, from delayed starts to ending the semester early to breaks in the middle of the semester. We needed to disrupt the semester, but minimize the disruption to the teaching schedule. So the final decision was made to start the semester on time, leverage the planned break with the upcoming VP debate, and extend the break to 2 weeks to break the transmission cycle, and then to go online after Thanksgiving. I think this approach is going to serve us well. President?
Thanks very much, Stephen. Appreciate it. So glad you're here. You joined just in time. Now I'm going to send us over to Vice President Jason Perry, who can talk in a little bit more detail about the debate ahead.
Thanks, President. I'm glad to have you all here in this town hall as we talk about the vice presidential debate. President Watkins asked me to spend a minute about how we got this debate here and some of the efforts underway. And I think it's important to note that this effort started well over a year and a half ago when the state of Utah, through our legislature and legislative leadership, and the Utah Debate Commission partnered with the University of Utah to submit a bid for the state of Utah to host this at the University of Utah. At the time, there are 3 presidential debates, and there is 1 vice presidential debate. And when you submit your bid for one of these events, you don't know which one you're going to get. And we were curious what that would be. And it turns out by having the vice presidential debate here at the University of Utah, it has become the one of most interesting event in the whole country. In fact, in the world, this is the one everyone is interested in. This is the only vice presidential debate that is going to occur where we get to see these candidates on the stage answering questions about policy. So this is something that's a significant thing for us. And as President Watkins mentioned at the outset, this is the world looking at the University of Utah. Over 100 million people will be watching this particular event. And it's one of those events where it's just a critical part of our democracy, a critical part of this republic that we're a part of. And it's what we are trying to make sure is beneficial to our students. We do realize there is some inconvenience, and there will be for a little while. And we're hoping to balance that inconvenience against the good, not just for the state of Utah, but also for the ability to promote the University of Utah throughout the world. But we've been making a lot of effort to make sure that this is a student-centered debate. Everyone comes to me even now saying, how do I get a ticket? You can't get a ticket. Is the reality of this. Not only is it controlled by someone else, the Commission on Presidential Debates, but President Watkins made the decision that what tickets we do have, they will be given to students. And we'll be having a lottery for those students. We have students that have already registered their interest in being part of this lottery that they would like to come, and President Watkins will help randomly select those students. And every ticket, she does not have a ticket. President Watkins has already given hers to the pool for the students. I think it's just important to note because we are doing everything we can to make sure that the students are part of this event. And from the ushers to the volunteers to the people that are sitting in the seats, they will be students. One more note I thought I should mention as we talk about the benefit to the university. Not is it just important that we understand this part of the voting process, but we have been able to work with departments and colleges all over campus to implement this debate into their curriculum. From our math students to our architecture students to, of course, political science, people all over campus are talking about this debate and what it means to our society. So we're really trying to make sure that everything we do, which is our core mission, particularly through the Hinckley Institute of Politics, is to get people engaged in the political process. And we are doing all that we can to mitigate the inconvenience on one side with the benefit to the state and to the university and to our students on the other.
Excellent. Thank you, Jason. So as always, we had a lot of great questions that came in. I'm going to just summarize and kind of go through these. I want to take it back to the circuit breaker for just a moment and direct this one to Dr. Lacey and Dr. Reed, who are on the call. A lot of questions around travel. So maybe Dr. Lacey, you could the advice you would give to faculty and students, a reminder that this is not a fall break. This is we're online where we're encouraging folks not to travel.
Yeah, that's correct. You know, the classes are still resuming. Right? They're ongoing and they're just moved online. So what my hope is as a public health professional trying to look out for the university is that students take up their daily routine and they log into their classrooms just like they always would, and stick around the city and go about their daily life and employing all the tactics that we have been doing over the past 6 months, which is, being at home when that makes sense and physically distancing from folks and wearing a mask when we go out outside of our homes and taking our classes from online just as planned. And then we'll resume in that 2 weeks.
Excellent. Yeah, Dr. Reed, what would you add to that?
Well, I just add, remember that the majority of our classes are already online. And so for most of our students and faculty, this is no change at all. It's business as usual. What we're trying to do with a 2-week circuit breaker is further reduce the frequency of interactions on campus. That's not just for our students, but it's for our faculty and staff, all the ones who, for essential purposes, do not need to be on campus. So in most cases, it's business as usual. I think the other thing to remember is that the majority of our students do not live on campus. They live in the surrounding area, and so they are home. This is where they live. And all we're really saying to them is continue your normal educational routine. All we're really doing is taking a small fraction of the classes that We're focused on experiential education, a few first-year experiences, and taking them online for a couple weeks for all the reasons that Dr. Lacey said. It's about creating an interval where we minimize the frequency of interactions on campus, really driven by a lot of detailed public health modeling. And I will say, as a modeler myself, someone who models computers rather than humans, the models are very similar. And I looked at great detail at how this modeling was done and assessed the assumptions. It's a good model. It's a good practice. And as President Watkins said, many of our peer institutions have found themselves involuntarily being driven to a model that we evaluated alternatives and decided to implement back in the summer.
And I might add one point, Chris, and that is that when we return to some face-to-face class in the week of October 12th, everybody who lives in housing and residential education will have a COVID-19 test again at that time. So in the event that some of our housing residents have been traveling, we have the opportunity for them to be tested upon return. So thanks for that as well.
Excellent. I also want to welcome Senior Vice President Michael Good to the call as well. Thanks for joining us, Dr. Good. Dr. Good, kind of building on Dr. Reed's point, I think when we proposed this back in July, there were some skeptics out there, but it turns out this strategy is working well. Maybe just a brief update from University of Utah Health, what you're seeing, just a lot of people watching this and outside the campus community, you know, how's our health system still responding?
Thanks, Chris. The first thing that we're seeing, we are seeing the increased positive test rates at our testing centers. Just in the University of Utah Health System, we were averaging about 70 to 75 positive tests a day. We had that week with the windstorm that we don't quite know how things were so disrupted. But then last week, we're up and around 140, 150 positive tests each day in our health system. We're also in contact with our colleagues throughout the state. As you've read in the newspapers and elsewhere, right now with this last week, the 7-day average is about 900 positive tests a day statewide. 300 of those are in Salt Lake County, 400 of those are in Utah County. So we've seen the most acute and the steep takeoff principally in Utah County. And so we are seeing increased hospitalizations as we talk with our colleagues in other health systems. Interestingly, here at University of Utah Health, in our university hospital, we've not seen that step off. We're having about the same number of patients in our hospital today as we've had for the last couple weeks. Now, some of that just may be the scenarios that we're worried, and why we think this circuit breaker is well timed, is we don't want the individuals with those infections, as Dr. Lacey pointed out, spreading it to their parents, to their grandparents, and so on. So just to repeat what everyone else has said, this next couple of weeks, it's important that we really limit close interaction. Outside is better than inside. Small group or no group is better than large group, and always with a mask on. I'll put out for the community today an interesting study that appeared in the New England Journal of Medicine over the weekend, that wearing a mask, if we do encounter someone with the infection, we actually get a lower dose of the virus. And that lower dose, the authors believe, results in lower symptoms, or even these asymptomatic cases that we hear about. And so there's emerging evidence or emerging thought that the mask not only slows the spread from the persons infected, but it may actually really change the course for the uninfected person who comes near somebody with a coronavirus, and really knocks down the dose of virus that they get. So keep wearing masks, and as the president said, follow the guidelines and create space during this 2 weeks. It will allow us to do a lot of continued activities if we break this cycle.
So a lot of questions about access, but before we get to those, I want to come back to Jason Perry. Jason, based on what Dr. Good just said, obviously there's kind of the underlying kind of elephant in the room is, so you're still hosting a big event on campus. Do you want to talk about just some of the health and safety protocols that the Commission on Presidential Debates and the university will be doing to make sure that the VP debates, folks within the perimeter, will be safe?
Yeah, happy to talk about that because a considerable amount of effort has gone into those exact things. An important thing to note is that even though our visual to the rest of the world is bigger than ever, the number of people coming to campus is the lowest that we've ever had for a debate. For example, normally you have 900 plus members of the press that come to a particular location. Now it's between 200 and 250. Which is a lot less, but we've also made it in the places that they're going to be. For example, I was in the media tent just this morning. Every one of those members of the media will be placed 6 feet apart from each other at least, masks enforced, and also in terms of testing. No one will be allowed in the perimeter where any of these events are happening that has not tested negative within 72 hours of the event. And so that means everyone that's there, that's starting to build even now, will start being tested to make sure that we have an event that is healthy and safe. Of note, through the leadership of Dr. Mike Good, who's here in this town hall, and the Cleveland Clinic through some of their protocols, we have a very, very strict set of circumstances that we'll put everyone through that is part of this event to make sure this is safe and largely scaled down in terms of the number of participants.
Thanks, Jason. I want to bring Chief Safety Officer Marlon Lynch into the conversation. Marlon, a lot of conversations in past years about, of debate as a chance for people to come to the university to express, their thoughts, to gather, to have debate parties. This year, because of our file guidelines and where we're at with the coronavirus, we're doing just the opposite. We're actually discouraging folks from being on campus. Do you maybe just talk briefly about the safety impact and what your team is advising folks who might think they want to be coming to campus to participate in activities?
Of course, Chris, thank you for the opportunity to share with this what some of the plans are that are associated with this. As everyone could imagine, safety and security for a national, actually international event like this are going to be a priority as well. And so with that, we can anticipate that an event like this does attract a lot of people to want to attend. As you heard from Jason Perry, the actual number of people that are going to be actually participating in the event itself has been drastically reduced. And so that in itself changes some of the safety and security aspects of it. However, we do plan, our community should plan to see an increased level of law enforcement and security on campus throughout that time frame. With that, we are working very closely with our partners at Salt Lake City Police Department, Utah Highway Patrol, as well as United States Secret Service in our planning and how we actually operate during those particular events. There will be communications that will be shared with the community between now and the debate itself that will give information in regards to what to expect, what the impact regarding access to different roadways and to campus itself. So that information is pending and it will be received. We're also sharing information with our neighboring communities immediately around the university in regards to what to expect and how we may be able to assist them during that time frame with that. So we do expect that there will be those that want to share their freedom of speech and exercise certain rights as well. And that's fine. That's what this event is about with that. But we will also be able to engage them. We've started to engage some of those groups that have announced that they will be present. And we are in communications with them, sharing with them what the plans, the operational plans are and the areas that would be available to them as well. We will have a set of perimeters that will be set, specifically largely impacted would be the President's Circle area with that and with access to our community itself, specifically to researchers who may have a need to access their research during that time frame. They are currently being vetted and credentialed that will give them that type of access. Just throughout that 2-week time frame, the buildings will be closed, but for those who have regular access that are outside of the impacted perimeter would still have access to the areas as well. So I guess the anticipation is it is an international event. There will be a heightened level of safety and security. The expectation would be that if you may not have access to that, you will not be given access unless you have taken and followed the appropriate course to obtain it during that particular time frame. And as I stated, there will be lots of communication between now and then shared with our community on how to gain it or to be informed in regards to where the areas will be impacted.
Thanks, Marlon. All right, we're going to move to the speed round now. So I'm going to give Dr. Reed the chance to talk to faculty, Dr. Pataki the chance to talk to our research community, and Dr. McDonald the chance to talk to students. And the question is, what in those audiences, what do they need to know? What are the basics? So Dr. Reed, you want to start by talking to faculty and instructors?
Sure. Well, during the 2-week break, circuit breaker, business as usual, and continue to support students and respond to those. We have had a couple queries about access to classrooms. If faculty want to be able to teach electronically, that's entirely possible, subject to the constraints that Marlon just mentioned. Work with your department chair and dean. We can make that happen.
Excellent. So Dr. Pataki for the research community.
Okay, so researchers, you can continue to do your research during the circuit breaker. We ask that if you can work remotely, please do work remotely. So for example, office work should be done at home, and everyone should follow the advice that we just heard from Dr. Lacey and Dr. Good. We'd like researchers to restrict their time on campus, the minimum amount of time that's needed to work in their lab or other research facilities. Keep groups as small as possible, and as always, follow our masking and physical distancing guidelines. So far, the research community has done an outstanding job of complying with safety guidelines. So thank you to all the researchers, and please continue to follow the safety policies. If your lab is in the security perimeter for the VP debate, you should have already been contacted by your dean or department chair. Almost all the researchers impacted by security are in the College of Science or Mines and Earth Sciences. If you're in these colleges and your building is impacted, you should have already received instructions from your department or your dean on what to do. And if you have any remaining questions about research, just contact us at vproffice@utah.edu.
Excellent. All right, Dr. McDonald, if you'll close us out here with maybe first off, what do students living on campus need to know, and then students just in general?
Wonderful. Well, our services are widely available, just going virtual, just like the classes. Our Eccles Student Life Center will be closed, but there will be online workouts. The McCarthy Track and Field, which is an outdoor facility, will have some access. But things like advising, counseling, library support, all of these things are still available to students, just in a virtual format. The Union Building does have a computer lab that will remain open, with the exception of October 5th, 6th, and 7th. But students who need access that way can do that. We will have food service available for Collard Village, Peterson Heritage Center, and the Lassonde building for our students living on campus. And we know that we can do this, just as everyone has mentioned. Following the public guidelines, health safety guidelines while we're here is incredibly important. And we are excited to celebrate the debate, the middle of the semester, and just keep going. Thank you.
Excellent. President Watkins, do you want to close us out with a few remarks?
Yes, I would just say the circuit breaker is real, and a real action around safety. You can see it by looking at what other institutions are doing when they get into a challenging situation. I am so grateful to our public health folks who could see that way back in July, who would be well served by a 14-day break. It is also true that while the vice presidential debate is an enormous opportunity to showcase the U, it is also a challenge and an inconvenience. Thank you all for what you're doing to support this incredible opportunity for the University of Utah, and to accommodate accordingly. So best wishes for 14 days of remote learning and work to the extent possible. Stay well and stay safe, and thank you for everything you are doing to support the University of Utah through this period. I am grateful personally, and I know all my colleagues also share that gratitude to all of you for all that you're doing. Stay well.
Thank you.